that is everything around you that you call life was made up by people that were no smarter than you.
So tuberculosis is a really widespread disease around the world. A total of 1.5 million people died from tuberculosis in 2018. So worldwide, tuberculosis is one of the top 10 causes of death and the leading cause from a single infectious agent. In 2018, 10 million people fell ill with tuberculosis in the world. So 5.7 million are men, 3.2 million are women, and 1.1 million are children. There were cases in all countries and age groups, but tuberculosis is preventable and curable. So tuberculosis is caused by a bacteria and it most often affects the lungs. So it is spread through the air when people with tuberculosis cough, sneeze, or spit. Most of the people who has tuberculosis lives in low and middle income countries, but tuberculosis is present all over the world. So about half of the people with tuberculosis can be found in 8 countries. So there's Bangladesh, China, India, Indonesia, Nigeria, Pakistan, South Africa, and the Philippines. In the Philippines, there are cases that aren't treated properly or aren't even treated at all. So according to a study, a huge portion of the community, as of now, is still unaware of the health services that are available. So most tuberculosis services and medications are supported in government health establishments. But there are instances where a patient with tuberculosis was not willing to be treated due to his idea that he still needs to pay for the health services. So if there are more people who don't know this information, then there are more people who are possibly putting off going to hospital until their illness has worsened, making them harder to treat. Tuberculosis is treated with a standard 6 months course of antimicrobial drugs that are provided with support to a patient by a health worker. But without support, treatment adherence is more difficult for the patient. So as a medical biology student, we study the anatomy and the physiology of the body and the diseases that affect the body. So being a pre-med student, I should strive to study harder and to make sure that I study properly so that in the future, when I do become a doctor, I can give the right treatments to my patients, I would run the right tests to diagnose them properly, and also I can give them a diagnosis based on the information that I studied when I was still a student, and also so that with the right information and the right knowledge, I could avoid any adverse drug events as a doctor. So that's it for today's vlog. Don't forget to click the like and subscribe button, and I'll see you guys in my next video.